It's with pleasure. I'd like to introduce today's presenter, who is Dr. Sarah Nolan. She is both the Assistant Director and the Director of Training at the Counseling and Psychological Services at the University of Albany in upstate New York. Her areas of interest in research and practice include training, social justice, and the development of culturally responsive clinical practice. Today, she's going to be talking about self-care practices, which is clearly an essential component of supervision and of survival.
So why self-care? This quote that compassion for others begins with kindness to ourselves, I think is really important. I think people who are drawn to this profession really care about other people and want to help other people. In order to really, truly have compassion for other people, we do need to also be kind with ourselves and have some compassion for ourselves. So a working definition of self-care is that it's an engagement in any activity which enhances an individual's overall wellness in accordance with the determinants of health, includes holistic health, prevention, and wellness. So, it's really a self-defined term. And there are a lot of things out there that tell us ways we can take care of ourselves, things we can do to better ourselves, but it's really an internalized construct. And so we really need to figure out what is it that fills our cup. It might not be the same thing that fills our neighbor's cup. And why this is important to consider as a supervisor is because, of course, your supervisee, just like they're not going to become you as a therapist, they're not going to be you in the ways that they take care of themselves. So really thinking of the individual nature of this and the fact that it is going to be different from person to person. There's some real clear hazards of our profession: countertransference, compassion fatigue, empathy fatigue, vicarious or secondary trauma, and burnout are all things that a lot of us experience, and self-care can help moderate or mediate those experiences.
A quick question. When you say countertransference, you mean if it's not managed? Because one of the major roles of supervisors is to assist the supervisees in managing countertransference.
It's a very good point, Carol. Countertransference, burnout, all of these things are very much realities of our profession, but it's about being able to manage all of them. So self-care is essential to being able to manage that. I like this notion of this poor self-care deadly dozen. All of us have had sort of negative clinical experiences at the same time as having maybe a negative personal life experience, and at the same time as maybe having a supervisor who, wasn't what we needed in that time. And so when we look at the importance of being able to take care of oneself, it's really because we can't control our environments all the time. And so this is a list of things that can really hurt us as clinicians and as supervisors. Having a toxic supervisor and colleague support. So not being able to have fun in life or at work. Only a fuzzy understanding of your own needs. Understanding your own needs is obviously an essential aspect of taking care of yourself. Not having again, we're going to have difficult professional experiences, but we've got to have a place to debrief and grow from them in order for them to not be these sort of toxic experiences. No energy-giving personal life. An inability to say no to unreasonable requests. So certainly, this is one of the characteristics that I think sort of draws people to our field sometimes is that we really want to help people. We really want to support other people. And that can lead to this difficult area where we have trouble saying no. We have trouble setting boundaries with folks. Vicarious traumatization that takes an accumulated toll. So we all generally know that trauma can accumulate. And so the impact of that can be devastating or debilitating to us. And so being aware that the same thing happens with vicarious trauma. So we can feel the trauma from our clients, from our supervisees. Personal relationships that are predominantly one-way caring relationships with self as a giver, of not trying to be the perfect therapist or the perfect supervisor all the time or ever. A strong need to be needed. Again, these are some shared traits that many of us have where part of what we love about what we do is that we feel needed, and that's important to us. It's important to acknowledge that, but also the negative toll that can take. And then professional success defined solely by a client, a student, or a patient, positive change or appreciation. And so this is a big one. If we are putting our worth and our value in somebody else's ability to grow or develop, that is probably not going to have a great outcome.
So maybe this would be a good point to stop to ask the group to kind of think about all of these factors and think about which ones may be placing them at risk and which ones need to be addressed.
I want to switch a little bit to talk about the importance of sustaining the professional self. So sustaining yourself, 80% of therapists surveyed agree that one of the high hazards of high touch work was emotional depletion. And so the common factor in high touch fields is the caring cycle of empathic attachment. So leading to active involvement and then felt separation. And so we have to be really careful about how we are personally impacted by that process. Finally, practitioners are social people by nature, and they seek others out. So finding support from other professionals, professional organizations, consultation groups. Hyatt found that number of hours worked with trauma-specific clients had a direct correlation to psychological distress in counselors. That means that we really do need to do something to counter that psychological distress.
You're raising such an important point, to realize that these consequences are not inevitable, and that furthermore, there's an emerging body of research that's suggesting that there are all kinds of things that one can be doing.
So when we think about the things that we can control, I think that's really important to focus on for a lot of reasons. If we feel like we can control the outcomes, which we can to some degree by working with ourselves and also our supervisees on taking care of themselves, that is the area of which we have control. So that's a really good point. You have to take action to be really taking care of yourself. And so the idea that we're aware of the impact of things on ourselves is one thing, but we really do have to take care of ourselves in order to mediate these negative impacts. Burnout is a real reality for us in our field. And so we need to really look at it and think about what creates burnout, what makes burnout more likely and worse, and what helps us prevent burnout. Work overload, which, again, when Carol and I talk about, that there are certain things you have control over and there's certain things you don't have control over. Obviously, work overload is a bit of a complicated factor there, because we are responding to things that the people above us are often asking us to do, or we're trying to get all the things done that our agency needs us to get done. I think we don't want to look at these things in isolation because they're all factors. And so we need to acknowledge the ones that are sort of outside of our control and then really focus on the ones that are within our control. So with burnout creation, we've got work overload. But with burnout prevention, it's having a sustainable workload. So in order to figure out what a sustainable workload is, that's going to be individual to oneself. And so figuring out what is sustainable for an individual. And that's going to depend on a lot of things in your life and your style of work. Lack of control leads to burnout. Feelings of choice and control lead to burnout prevention. So, there are lots of things we can't control, but oftentimes there are things we can control, smaller things within the things that we can't control. So for you as a supervisor, as an individual and a clinician, thinking about what are the things that I do have control over, and even more to the point with your supervisees, when they come to you with something that they feel they have no control over, it's very important to work with them to figure out is there anything in there that you do actually have control over? And of course, right now, the way I'm talking about it, you could also talk to your clients about this, but that parallel is something that, is very real. Why don't we take a minute to reflect on the things that we do have control over and the things that we don't have control over. But I would challenge you to, even within the things that you find that you don't have control over, to look at the smaller pieces within there to see if there's anything you can identify that you do have control over. Burnout creation happens with a breakdown of community, whereas burnout prevention happens with a sense of community. And so this is where it gets really important to think about what is the culture of your office space. We talk sometimes about community care, building a community at your agency where people really care about one another. And there is a sense of community that requires trust and it requires getting to know one another. But a sense of community is very much can counter the impact of some of these other less controllable things that we have to deal with in our professional lives. So are there ways that you can build community within the agency where you're working right now? One thing that I think helps build community is creating some kind of regular meeting. And it doesn't have to be often. I think when it comes to this sort of thing, it's more that it's reliable and consistent. So maybe a monthly meeting where folks have some kind of shared reading, or you process some sort of shared experience, but it's a time to connect. Even if it's only happening monthly, it's creating this sort of dependable space where people can connect. I also think having things like a lunchroom or other spaces where people can, on a daily or near daily basis, feel like they're connecting about something besides work with folks. Building community that I think is very difficult in COVID times, because everybody is tired of Zoom, and it's the only way to really engage with people face to face. So I do think there's room for us to be thinking more creatively about how can we connect over Zoom. There are actually a number of board games and other things that you can do over Zoom. And so creating, maybe an hour during a week where you and your colleagues get on Zoom and do something that's not about work, but that's more about sort of having fun, bringing something else about yourself besides your professional self to the meeting. I have a couple of measures or assessment tools here that can be really interesting for sort of taking an assessment of your own professional quality of life and your own self-care. It might be helpful to click on these links and take a look. They don't take a long time to get through, but just peruse the list and see how these assessments are sort of assessing for compassion satisfaction and compassion fatigue. Okay, so now that you've had a chance to think about some of the ways that you are taking care of yourself or not taking care of yourself, the good news is self-care works. And learning how to fill up our own cups or take care of ourselves is a really important and can be a really beneficial thing. One study found that self-care activities were directly correlated to an increase in overall wellness. That is not surprising. Another found that introducing the concept of wellness into the supervisory alliance mitigated the impact of supervisee stress on the supervisor. So again, bringing this up with your supervisees, talking to them about giving them space alone acknowledges the importance and the value of it, which will introduce that idea to them. And then I'm going to run through briefly a wellness model of supervision. There are 4 stages. One is needs improvement, so lack of understanding as to concepts of self-care and wellness. So being honest with yourself about maybe this is where you are, or figuring out if this is where your supervisee is. And then basic, being able to define self-care in the context of the profession, but maybe not having a more sort of whole idea of what self-care looks like in the context of a person's whole being. Proficient, able to define and apply self-care concepts on a regular basis. And advanced, has a personalized wellness plan, engages in self-care practices on a regular basis, consistent with routine. And many of us are not at the advanced stage of the wellness model of supervision. So this is aspirational. So really thinking about where I am now and where do I want to get to. In terms of using the wellness model in supervision, you want to begin with creating an environment of safety. So there needs to be a supervisory relationship. Obviously, we know, especially after this program, how important the supervisory relationship is. But it's particularly important if we're trying to influence this area. Using humor and having a clear focus to include wellness. So very deliberately including wellness. Being genuine and congruent to the model, so practicing what we preach. Our actions are equally as important as our words. Even if you don't do it perfectly all the time, you are sort of striving to and appreciating the importance of adapting self-care into your life versus somebody who just sort of says self-care, self-care, self-care. So really, before you try to do this as a supervisor, you really want to, as an individual, think about and start to develop your own self-care routine. And then be cognizant to remain non-judgmental and avoid shaming. Again, there's a real individual nature to self-care and to just figuring out what fills you up, what fills your spirit, really. And so being non-judgmental when working with other people around this is really important. Being open to vulnerability. So, the supervisory relationship is personal. We know that. But when you talk about wellness, it's a particularly personal topic. And of course, it relates back to our clinical work, and it relates back to sort of getting ourselves suited up to do the clinical work, but you just want to be aware that it could be a vulnerable space for you or for your supervisee. Normalizing through appropriate self-disclosures. So, the idea of talking about the way that you take care of yourself may lead to self-disclosures, and so you just want to be aware of that and normalize the fact that that's part of the process while also maintaining appropriate boundaries as you always would. And focus on the relationship with the supervisee. So you want to be consistent. If you're going to talk about wellness and self-care, that should be now infused into the relationship. So it should be part of you checking in with the supervisee. So developing a wellness plan is developing a consistent plan to engage in mentally, emotionally, physically, and spiritually nourishing activities. So thinking about what does this look like for you, your supervisee in each of these areas, and being specific with activities and ways that they will take care of themselves. Scheduling rejuvenation and restoration around times of high stress. So what might these look like for your supervisee? And are there certain times, certain clients where they may need more of this than they otherwise would? And preparing a list of emergency strategies. So incorporating any policies or expectations surrounding incidents at your agency and knowing your supervisee's areas of strength and difficulties. When you're going to talk to your supervisee about something as personal, about taking care of themselves, you want to also be sort of aware of them as a clinician and knowing who they are professionally as you work with them on developing this part of themselves.
Such an important point. It also speaks to the boundaries that you don't want to be crossing inappropriately into huge areas of personal exploration as a supervisor.
To that point, like with many decisions that we make as supervisors, you really want to think about, it's not going to be one size fits all for each supervisee. It may look very different depending on the relationship you have with your supervisee. So some other aspects to sustaining your professional self, knowing that venting can be cathartic. So being able to openly share with other professionals can greatly reduce the stress and dissatisfaction experienced by some of us. And again, when we talk about boundaries, this is another area where we have to have boundaries. So venting in a way that is going to be helpful and productive is very different than sort of complaining or giving space for a lot of complaining. And so making sure that if that's part of how you unwind or release, then keeping it within its proper boundaries. Professional association involvement is a way of connecting with the larger community. So again, connection with other people, other professionals who can more deeply understand the work that you do can be really helpful for your own self-care. Of course, if you're going to join associations and become involved in leadership in every organization and all it's going to do is drain your personal resources, that's different. We really have to critically evaluate what ways of taking care of ourselves is pulling out of us as compared to what it's giving to us. And we've got to be honest with ourselves, and we can't shame ourselves. I wish I could do more of this. I wish I could do more of this. We've got to be careful with ourselves. It's very important to receive care from our mentors. So, as a supervisor, part of your role is to care for and help your supervisee learn about boundaries and understand how to make these decisions about balancing what they feel like they can handle, what they can't handle, and how to take care of themselves. As supervisors, we have to find our own mentors or administrative supervisors who we can really have these conversations with about our own stuff. And, one way that I like to talk about it is calling them talking partners. And so they're people who you really can lean on and bounce things off of, mutual respect. They may be people who are senior to you, who are not senior to you. It's more about finding people that you really trust. And the act of mentoring and supervising can be very positive and helpful for our own self-care and professional development. And we can't undervalue that. So for a lot of us, it fills us up to be able to give to, other, more junior professionals. And so we get a lot out of that. Facilitating peer consultation groups, some of us that really fills us. It makes us excited. It makes us feel connected. And so really thinking that some of the professional things even the things that are part of our job, can sort of be included in a bit of our self-care. It's important to be playful while also being professional. I think this is just such a great statistic. Maintaining a sense of humor was the #1 career-sustaining behavior in a study of therapists, endorsed by 82% of the sample. So having a sense of humor, especially, when we're doing really hard work, and right now we're all being called upon to be very adaptable and sort of, live in this uncertain time, while still continuing to do this high impact, high intensity work. And so not taking ourselves too seriously as we move through the work that we're doing. Often people in our field are very worried about screwing up and really very conscientious to a point that crosses the line from adaptive perfectionism to maladaptive perfectionism. And so it's really important to take a kind of honest look at yourself and think about where am I on that spectrum? When is it not useful for you anymore to be a perfectionist? And when do you maybe just have to let things go? That's part of self-care. Veteran practitioners learn to pace themselves, always being ready at critical moments, but pulling back at non-critical moments. So that's really clearly learning how to make that judgment about when you've got to be fully on and when maybe you can take a breath. The process of setting limits involves learning to tolerate the risk of disappointing other people. Again, very hard for a lot of us, but learning that we have to put ourselves first. Otherwise, we're not going to be good for anybody. A really important thing for us to consider as supervisors, as clinicians, is setting priorities. There will always be too much to do. And so we've got to be able to sort of prioritize and let things go when we're not going to get to them. Accessibility by phone and email has eroded boundaries between work and non-work, particularly now. Many of us are working from our homes. So there's this expectation that you'll always be available. And particularly as a supervisor, we can very much feel like our clients, our supervisees clients' lives are depending on us. And so we've really got to learn how to prioritize when that's true and when that's maybe not true. The fast-paced and information overload that we see in our society right now probably contributes to emotional irritability, concentration difficulties, sleep issues. And so we're living in a world where no matter what your profession is, there's a higher level of intensity and a higher level of expectation from people. So particularly when we're working in a caring profession where we're taking care of others, we've got to be particularly aware of how we're taking care of ourselves. One of the major ways to manage this is through self-organization, structuring, and planning. So figuring out how you can structure your life in ways that are helpful to you managing all the things that you can't control. Again, getting back to the idea that there are some things we can control and some things we can't control. As we talk about some of these things to consider in terms of creating a lifestyle that lends itself more easily to self-care, I would ask that you take a few minutes to reflect on what are some of the things in your current life, professional life, that you can't control, and what are some that you can control. A couple of final thoughts. One is that learning to pay attention and be respectful of your needs and to meet them responsibly is a lifelong task for therapists. This does not come naturally to most of us. Many therapists struggle with feelings of selfishness when they think of trying to meet their own needs. I'd imagine that several people listening to this right now think that it might be selfish to put yourself ahead of your supervisee or your client in certain times. And of course, certain times, yes, they do need to come first, but being able to really distinguish between when they should come first and when you should come first is a skill. As therapists, we use our training to help clients become more self-aware and self-tending, but for many reasons, we're reluctant to offer ourselves that same kind of understanding and care. And so reflecting personally on what is it that I expect of myself versus what is it that I am, trying to help my clients and supervisees achieve. And in reality, self-care might ultimately be the most important thing that we do for ourselves, but also for our supervisees and for our clients. So 10 sort of dreamy, some of which we cannot even do it right now, taking a vacation. And that doesn't mean, going to some really expensive, fancy island, but rather just taking time that is just for you, taking time off, engaging in social activities if that fills you up, if you're an extrovert-leaning person, getting emotional support from colleagues, doing pleasure reading, seeking consultation on difficult cases. Again, self-care activities can still be within the professional circle. So, having support from colleagues around difficult cases, reading relevant professional literature, taking breaks during the workday, going for a walk outside, shutting down whatever you're working on and just turning on some music that you like for 10 minutes. Getting emotional support from friends or family. Spending time with children, and listening to music. So I'm going to leave you with a few questions. When trying to set self-care goals, it might be helpful to consider some of the following. And so I'm going to share these with you and then ask that you spend a couple minutes figuring out which ones are most interesting to you and taking a couple minutes to share with your group.
And what a wonderful overview of self-care as a critical part of our lives in general, and especially in this particular environment, but moving forward as well. Thank you so much.
All right. Thanks, Carol.